Thank you, Rob. So today I'm gonna present part of the work that I did as a visiting scholar at St. Mary's Hospital, which is part of McGill University. And I'm not going into numbers. I'll just show you some of the results that we found. And what is interesting and what I would like to underline is the fact that this work came out from a lot of discussions with the previous head, actually, of the emergency department at St. Mary's, who has been a chief since 2009, and he just quit, so it's been chief for quite a long time. And what I want to say that all these results that I'll present are really the result of this back and forth discussions, continuous discussions and ideas, and so I want to thank him also for his availability and to talk to me and to give me the opportunity to present this. And so the goal of the project, basically the project concerns the analysis and prediction of emergency department crowding over the period, for now, 2010-2015. So these are the results I'm showing to you, but I'm working, of course, also on
that's not a problem we haven't.
Okay, and so basically the idea was this: by observing patterns of arrivals, departures, and occupancy, the goal was to identify basically time windows during which crowding took on critical proportions, and to understand aspects of hospital functioning that may impact rates of crowding. And so basically our hope was that understanding these patterns of arrivals, departures, and occupancy could lead to simulations of the effect of potential interventions in order to compare their efficacy and thus improve patient care. And here I will show you during this presentation one potential intervention. But what is interesting to note is that this intervention came out of these discussions with Dr. Ma, and we tried to apply it on the numbers. So I'll skip this. I'll just give you a few words. Everybody knows why emergency department overcrowding is a problem. So here I just listed a few, like part of the issues. Probably there are many more. And so there is a huge literature on this. So some of the issues are suboptimal care, increased medical errors, delays to time-sensitive therapies, risk of transmission of contagious diseases, poor outcomes, increased cost and length of stay, increased risk of readmission, increased risk of death, lousy way to treat patients, etc. It's a long list, and here I just want to show one of the contributions from St. Mary's Research Center on this, which is basically shows that the relationship between increases in emergency department occupancy and increase in adverse 30-day outcomes, basically mortality. And this was a contribution from the group of Jane McCusker. And okay, so now I'll come to the data talking. So what did the data say to me? And so the question was basically, are there any temporal patterns in the levels of occupancy, arrivals, and departures? And now I'm going to show you a sequence of pictures where I'll try to explain to you in a very basic language, I hope, what this kind of data say to me. Okay, so here you see the time series of occupancy. So it's an average over the 6 years that I've considered. And you see here below the hour of the day. Here you see above the month. And in the legend there, you see the type of day. So what I want you to focus on is the color, the pink color, which is basically the Sundays and the Saturdays. Just to show you, so the curves, basically I color the curves of occupancy by the kind of day. And so I ask you to focus just on Sunday and Saturday, because what is evident here of course you have the levels of occupancy. The maximum here is more or less 35. So what is evident here is that the weekend has a specific pattern, so usually lower levels of occupancy than the weekdays, which is kind of expected. So here we were just looking at the data. And here we tried to look at the arrivals, and you see something similar. So again, the number of arrivals are lower during the weekend. Again, focus on the pink, the two different pinks. And okay, and here you see kind of the same thing. Here it's a bit more mixed up because as you can see, there is a lot of variability in the departures because departures depend on many other factors. So, but again, we can see something. The weekend effect is still present, but of course it's much more mixed up in the other curves. Anyway, then we tried to model something. So we wanted to measure, actually, to see if there was some temporal effect. So if basically the years or the months that we considered and the weekdays or the hours of the day had a special impact on the levels of occupancy, arrivals, and departures. And so we started with occupancy, and here we use the regression model. And again, I'm not showing you the number, so this is just a picture. So basically, the more the points that you see are on the right, the more there is an effect. So with respect to the years, we see that there is a special effect in 2012. Basically, the average occupancy was almost 5 patients more than 2010. I won't go into the details of this. I discussed this with Dr. Ma, so there is a reason for that. Then with respect to the months, with the exception of April, all the other months present lower levels of occupancy than January. So here what I didn't say is that we had, since all these factors are qualitative variables, as we call them in statistics, we had to fix a reference point. So the reference year was 2010 here. The reference month was January. The reference day, type of day of the week, was Sunday. And the reference time was of the day, the reference hour was midnight. And so basically what you can see, the most interesting thing here is this. Okay, this was the effect of April, but again, here there is a reason. So, and what you see here is that there are lowest levels on June, August, and September, so the summer, and usually this is true. So we have lower levels of occupancy at the emergency department during the summer. But what is interesting here, and which is something that we'll see again later on, is this and this. So here you see the effect of Tuesday, Wednesday, and Thursday. So I wrote there high impact of weekdays with respect to Sunday, which is the reference, with higher level for Tuesday to Thursday. And it's between 3.5 and 4 more patients, so during the central days of the week. And what is even more important is this. So basically, you see that during lunchtime, the levels of occupancy go up. So as you can see, so here we start from, this is 23 p.m., so this is 11 p.m., and this is 1 a.m. And so the reference point is midnight. You see that by the course of the day, so the levels of occupancy go up until they reach the maximum level at 1. So you see 11, 12, 1, 2, etc. And then occupancy starts to go down. And basically we have 5 more patients between 1 p.m. and 2 p.m. Then we did the same thing for the arrivals and the departures, but here we consider some more sophisticated models, which are called Poisson regression models, just because the number of arrivals and the number of departures are counts, are not continuous variables. But again, here we see something interesting. So I'll skip the first part because we don't have any effect for the month. We didn't have any effect for the years. We see that there is a high impact of the weekdays with respect to Sunday and no impact for Saturday. But here again we see something that we saw before that impacts actually the levels of occupancy. Between 11 a.m. and 12 p.m. the number of arrivals increased, and here I did some calculation, increase of the 148% with respect to midnight. And the calculation is very simple, so here I wrote how to do it. So you get the coefficient of the Poisson regression model, you do the exponential, you subtract 1 and you multiply by 100. And so this is the way you can read it. And anyway, we can see that basically the hours between 10 and 15, so 10 a.m. and 3 p.m. look more critical. And with respect to departures, again, I would like to focus on the hours of the day, because again, we see that the lunch time is a very critical time, and especially here we start seeing patients going away, so either being admitted at the hospital or going home. So between 1 p.m. and 2 p.m., the number of departures increased of the 159%, while between 2 p.m. and 3 p.m. of the 184%. So, and this will impact again the levels of occupancy, because we'll put down the levels of occupancy. But now we'll look at this in a different way. So don't be scared by this plot. So you see in purple the levels of occupancy, but I wanted to show the relationship, so how the numbers of arrivals and departures impact the level of occupancy. And so basically, here you see in blue the arrivals, and so the blue bars are the arrivals, and the red bars are the departures. And then I colored in green the mismatch between departures and arrivals, which is what is critical. And so basically I called it delta, and delta is the difference between arrivals and departures. And you can see that after so basically during lunchtime, delta becomes negative. So basically the numbers, finally the number of departures surpass the number of arrivals. And so this helps the levels of occupancy to go down. And keep in mind this plot, because now I'll show you what we did. So this is another way to show you the same thing. So it's just to show you that at some point after 1 p.m. the level of departures finally surpass the number of arrivals, and so again at the emergency department they start to breathe again. And okay, here we wanted to see the same thing with respect to the type of days, but again we underlined, we saw that basically the worst day for the arrivals is Monday, and the best day for the departures is Friday. And so, but and then here we don't see any effect with respect to the months. We don't see any effect, almost any effect for the years. So here is the point. What did the data, all the data that I tried to show to you, that I tried to talk to you, suggest? First of all, overcrowding demonstrated a predictable pattern throughout the 24-hour period. So basically, the hours of the day were the most important factor in the models also that I showed to you. Then, second, the daily overcrowding was related to a mismatch between arrivals to the emergency and departures from the emergency. And so here comes the intervention that we thought about it. So, and that's why we did a simulation. So we thought that shifting back the departures by 1 hour or 2 hours could improve the levels of could reduce the levels of occupancy for what we have seen. And so we just did a basic, I did a simulation to do this, and actually here is the result on average. So here you see the average levels of occupancy, average made over the 6 years again. And so you see in blue the original curve for the occupancy, and then you see in red the levels of occupancy if we shift back the departures by 1 hour, and you see in green the curve of the occupancy if we shift back the departures by 2 hours. And so basically you see here, you see the number of the patients, the average levels of occupancy. We see that if we shift back the departures by 1 hour, we reduce the average occupancy by almost 2 patients. And if we shift back the departures by 2 hours, we reduce the levels of average occupancy by 5 patients. And so basically this is a result and could potentially translate into better care. Okay, this is just an average. And I would like to show you the explanation of this with respect to what I showed to you before. So here you see basically the numbers of the arrivals and departures and how the delta changes. So this is what I showed you before. I told you that the delta started to become negative at 1, so the departures started to surpass the arrivals at 1. But see what happens if we shift back the departures by 1 hour. So basically the departures surpass arrivals starting from noon. You see the green starts here. And if we shift the departures back by 2 hours, it starts at 11. So the delta becomes negative. And so we see that actually what happened here, the fact that these curves go down, is because of the mismatch, is because with the simulation, like by shifting back the departures by 1 and 2 hours, we were basically able to reduce the levels of occupancy. And basically, what does it mean? I'm not a clinician, but I wanted to tell you why, the reason why Dr. Ma thought about this intervention. The reason is that most of the times the delays and the emergency department are due to the fact that many specialists come very late to the emergency to see the patients. And so the patients have to wait for a long time. And so the reason why he wanted me to do this simulation is because he wanted to show them how much is important, even to make the effort to come 1 hour before, how much it can change for them. So this is just to show you how this work came out. It was really a conversation, a continuous conversation over months. And this is just one of the things that we did. Okay, and here just briefly, I'm gonna finish soon, just briefly, we wanted to see if the same effect was present over the years, since before I showed you just an average over the 6 years. And again, you see always the same patterns. So the red curves are always in the middle, the green curves are always the lowest, so they represent the lowest level of occupancy. So again, so we see that it didn't change. Again, here, here it was with the years, okay? Okay, here we considered also the type of days, but again, we see more or less the same thing, the same pattern, it didn't change. Here we put the months, and of course there is more variability, but again, the green, for example, the green curves is always the lowest. So, and I won't go into detail. Here is just one more thing I want to show you without making you scared. It's just that at some point they wanted to see if, given these patterns, and this actually they look like predictable patterns, it was possible to use a statistical model to predict the level of occupancy. And so what I did was building a model. I used, this is called RMAX model. I won't explain you what it is. It's a very, very classic time series model. But anyway, what I did was to model the levels of occupancy on the first 5 years, so from 2010 to 2014, and then we used it to predict 2015. And what you see here is the prediction. So just note one thing, so the real levels of occupancy are represented in red, and basically you almost don't see these levels, but you see the blue, the light blue, which is the prediction, just to show you how good was the prediction, because so the model really worked very well, and we didn't include all the possible variables, so this was just a first attempt, but I wanted to show you the results of the first attempt we did, just to show you how strong these models are and what they actually can do. But it's also true that the patterns at some areas were very predictable. So, and it's on the other side, instead the number of arrivals and the numbers of departures are not predictable because they depend on too many factors, and instead the occupancy at the end has a maximum level of occupancy that so that can be reached at the hospital, and that's why it's predictable. But the number of arrivals and the number of departures, of course, they are. And so in this case, the model I used didn't work. Conclusions. So what we have seen is that predictable patterns emerge with respect especially to hour and type of day, sometimes month in our case, because April was a special month, but I won't go into this. Then we saw that basically what most contributed to emergency department overcrowding was the mismatch between arrivals and departures. And then we saw that basically a better matching of the arrivals and departures, so the attempt we did to shift back the departures, could significantly mitigate the magnitude of peak overcrowding over the 24-hour period. And this, of course, could allow for even better patient care and reduce ambulance diversions, maybe. And then we saw that, as a first attempt, that time series models can accurately predict hourly and daily the occupancy. As future direction, so future direction, which is something we have been working on, is the development and implementation of other interventions, like the one I showed you, to limit the daily peak occupancy by, for example, limiting the maximum occupancy of the AR, the interventions for early discharges home, or interventions for earlier admissions to the floor. But what I want to underline here is that we believe that what is best here is using really a participatory research approach based on mixed method. Why? Because basically so the results of this work show that this was possible because of all this back and forth with Dr. Ma. So it wasn't my work, but it was my work trying to answer his questions. And so basically it was this work that allowed us to find out what we find out. And so we believe that this kind of discussion should be enlarged, should involve the other healthcare providers. So basically we are thinking about semi-structured interviews, like after I did this analysis, but I also did some other quantitative analysis. So the idea is to show these results to the other healthcare providers and ask them what they think, what they would suggest, what they think that are the factors that would put down the occupancy. Because I'm the statistician, I can't say that, so they have to tell me this, and my role is to show them with the numbers what is happening in the hospital. And so we believe that this should be really a participatory research work, and this is for us the future here, but here at St. Mary's, everywhere. And just because this could change healthcare providers' behavior and improve better care, patient care. And I want to thank again Dr. Wittmann for this amazing work, because it was really an amazing experience for me, because I come from theoretical statistics, and sometimes in the past I didn't have the opportunity to see the effect of what I was doing, the effect of my research. And instead, working with him has given me the opportunity to do something meaningful, even if I used very basic statistics. And then I want to thank Eric Belzil, who is the senior statistician who gave me access to all the data and stuff. And thank you.